You may have clicked on this video because you find yourself having doubts around your child. What if I were to harm them? What if I don't love them enough? What if we don't develop enough of an attachment with each other? Even to the point of things that might seem taboo. My name is Dr. Patrick McGrath, and I'm a licensed clinical psychologist specializing in the treatment and diagnosis of obsessive-compulsive disorder. Now, I want you to know that the doubts that we have when a new child comes into our life are very normal and very natural. In the perinatal period, which is from the point of conception all the way through about a year after the child's born, or the postpartum experience, which is post-birth, you'll notice that there are many doubts that parents have about the safety of their child and how their behavior is going to affect their child and if they're doing things the right way or the wrong way. But if it gets to a point where it's actually interfering in your ability to love your child or to be around your child or to even enjoy the fact that you have a child, what might be happening is something that we call perinatal or postpartum OCD, or obsessive compulsive disorder. Some of the things that I've described might come across to people as not OCD, but that is very often because people think OCD is just putting things in order or checking things or making sure that I don't have germs. I want to assure you that OCD is far more than that, and there are many different subtypes of obsessive compulsive disorder, with perinatal or postpartum OCD being one of them. Unfortunately, I'm not in the room with you and I don't know exactly what's going on in your head, so I can't give you a diagnosis based on this video. But what I can do is let you know of the ways that perinatal or postpartum OCD might occur, how you recognize what OCD is, what's the cycle that it follows. I'm also going to show you some things that you can potentially do right away to help yourself get through this experience, and at the end, give you some links so that you can reach out to people who might be able to help you if this sounds like something that's occurring in your life. When we're talking about perinatal OCD, know that the likelihood is the person experiencing it is the person who birthed the child. But it doesn't have to be. Adoptive parents can have postpartum or perinatal OCD experiences. Foster parents might experience these as well. Even dads can have these experiences, or partners who didn't birth the child. Today we're going to run through the cycle of perinatal OCD. We're going to start first with some kind of a trigger. There's something maybe external or internal. What if after my baby's born I don't love the baby enough? What if while changing my baby's diaper, I accidentally rub too hard on their genitals as I'm wiping them? The obsessions then will be there. Did I want to do this? What if I did want to do this? What if I did this? What does that say about me as a person? OCD is the doubting disorder, and its goal is to get you to doubt things so that you will do the one thing that it wants, the thing that feeds it, and that is to do a compulsion. And what is a compulsion? It is a mental or behavioral act that one does to try to neutralize that obsession that they were having. It could be anywhere from, I have to hold my child constantly to prove that I love my child, all the way through never actually touching your child after it's born and having someone else take care of your child while you watch from afar. So we do these behavioral or mental acts to try to feel good in the moment. But you'll notice this in OCD, because it is nicknamed the doubting disorder, there's always a twinge of doubt. There's never that 100% answer where we feel great about it. What do we do to intervene here? Treatment for obsessive compulsive disorder involves something that we call exposure and response prevention therapy, or ERP. It really is two parts. Number one, exposing people to things that are uncomfortable. But guess what? OCD does that all the time. The key component of the treatment is the second part, response prevention. Do we do a compulsion or the opposite of the compulsion? And do we allow ourselves to live in the discomfort that OCD wants us to neutralize through the compulsion? By doing response prevention, we allow ourselves to learn something that we didn't learn with compulsions. We can handle being uncomfortable. How do we walk somebody through this experience? Let's use the example that maybe you're feeling right now, which is, what if I don't have enough love for my child? Allow for yourself to feel whatever feelings come after that initial spike of anxiety or fear or discomfort or whatever it might be. And I want you to allow it just to sit. Now, it isn't surprising if you actually notice it start to feel worse. That's typically what happens at first. That's your OCD screaming at you saying, you must now have an answer. I want you to start thinking, I'm noticing something that I've never allowed myself to experience before. I can handle it. I may not like it, it may not be comfortable, but I can handle it. That's the key in this entire experience. If we allow that just to be there, just to stay, over a little bit of time, you'll notice it hits a peak, and then it's going to start to eventually come down. As you practice that, my goal would be one of two things. A, the discomfort of that would decrease, which is likely what's going to occur. Or B, you learn, okay, I can handle doing this. I don't have to give in to everything OCD wants. And even though something in my brain is screaming, it's not good enough, I can be okay with that. I can handle that. If what I just described sounds like you, I want you to know that help is available. No matter what you're experiencing in this perinatal part of your life, please know that there are people out there trained to be able to help. It is essential that you talk to a professional who can help you to diagnose exactly what's going on. There are several places that you can go, one of them being the International OCD Foundation, or IOCDF, as they have a vast directory of therapists available who know how to treat obsessive compulsive disorder. And you can also utilize NoCD as well. NoCD offers live, face-to-face therapy sessions online with licensed therapists who are specially trained in treating people who have OCD and related disorders. About 2/3 of commercially insured Americans can utilize their benefit for the treatment of their OCD through NoCD. On NoCD, you can get connected with a licensed OCD therapist right away. You can do that through your phone, download the app, or go to the NoCD website. When you're working with NoCD, you'll start doing live face-to-face sessions with your therapist, and between your sessions, there's always on support. You can message your therapist, you can participate in peer-led support groups, and at any time, use the NoCD platform's self-help functionality for all the support that you need. I'll include a link in the description below and resources from Healthline to help you with your intrusive thoughts and any kind of compulsions that you might be experiencing around the perinatal or postpartum OCD experiences that you may be having. And please know this, help is available.